following measurements are obtained from a patient and there are 4 set of values here. Renal artery pH is given as 0.05 milligram per ml. Renal vein pH is given as 0.005 milligram per ml. Urinary pH is given as 20 milligram per ml. Urinary flow rate is given as 2 ml per minute. How to calculate the renal plasma flow? Renal plasma flow is measured by injecting para-aminohippuric acid, that is PAH, and then determining the concentration of PAH in the urine and plasma. And there is something known as extraction ratio. That is nothing but the arterial concentration minus the renal venous concentration divided by the arterial concentration. And the extraction ratio for PAH is high because PAH is filtered from the glomerulus and is secreted by the tubular cell. Effective renal plasma flow ERPF is calculated from the formula U into V by pH. U pH was the renal artery pH, V is the urinary flow rate, and PPH is given as APH in the previous slide. Here it is PPH, that is renal artery pH. From the given set of values, the ERPF is 20 into 2 divided by 0.05. That comes around 800 ml per minute. So the actual RPF is calculated by ERPF by the divided by the extraction ratio. The extraction ratio is 0.9 here. So it is 800 divided by 0.9, that comes around 889 ml per minute. Calculate renal blood flow from given data. Renal plasma flow is 700 ml per minute. Hematocrit is 45%. Renal blood flow is renal plasma flow divided by 1 minus hematocrit. So renal blood flow is equal to renal plasma flow into 1 by 1 minus hematocrit. So renal plasma flow was 700 ml per minute and the hematocrit was 45%. So hematocrit has to be converted into decimal. So it comes as 0.45. So the answer comes as around 700 into 1 by 0.55, which is equal to 700 into 1.8, and the answer we get finally as 1260 ml per minute. So the answer for the given problem, the renal blood flow, is equal to 1260 ml per minute.